was when I started seeing this, was around 2005, 2008. I noticed, for example, the change in our ice. As a little girl growing up in Minneapolis and Hennepin County, I would have birthday parties. We didn't have a lot of money, so our birthday parties were always, everybody brought their own skates and we went down to the local pond. And my birthday is November 23rd, and really quite reliably, I could always have skating parties. I remember in 2005, 2008, right in that time period, the ice was not forming, and it wasn't forming till around January or February. And I remember thinking, what is going on here? Similarly, as a child, I remember my head against the cold glass of the bus, watching out the window as I came home from school to see if I could see the first robin. There was a little ritual in our family that whoever saw the first robin, I don't know, we got to be kind of queen of the day or king of the day. It was a real special thing to know that winter was over and that there were signs that spring was coming. And it was such a reliable pattern. And then again, to early 2000s, I remember the chilling experience. This is a chilling, putting my head on the windshield, but this is a different type of chilling because the robins didn't disappear. They didn't go away. I saw them all year long, December, January, February. They didn't need to migrate. Similarly, in our family, we it's sort of an old-fashioned terms, but we decorate the graves on Memorial Day. In our family, in addition to Hennepin County, we're also located down in the Bluff County country, down by Lake City, Minnesota. And there's a cemetery with ancestors buried there. And I remember as a child, this was before the days of car restraints, auto restraints, and proper childhood restraints, sitting in the back of my grandmother's station wagon, surrounded by buckets of lilacs and lilies of the valley that she had collected from her yard to decorate the graves. And every time I smell either a lilac or a lily of the valley, it's just, I'm flooded with memories of that special family time, honoring our ancestors, and what that was like to be connected with the people that have already passed and the people that are coming. And now the lilies of the valley bloom in April or early May. Lilacs, the same thing. They aren't around for my children who will be decorating graves when they're older. And so these patterns, these disturbing patterns from what has always been, got me really looking at what is happening here. And the more I dug, the more I realized that the threads are breaking. The web of life is shattering or becoming very, very frail. And as you look at the science, humans have caused so many changes now that this is considered or called by geologists the era of the Anthropocene, in that it's not a dinosaur area, it's not a Holocene, it's not a Jurassic, it's the Anthropocene, where the impacts of humans on the Earth's natural systems is significant to be creating change. So, like all good public health folks, I wanted to get upstream and figure out what was happening. And the source of that sort of upstream thinking is the metaphor or the story of a village beside a river. And one day a body came down the river, and they waited out, the villagers waited out. They realized the person was still alive. They brought him in, they fed them, nourished them, housed them until that person was strong again. A few days later, another person came floating down, then a body, and then another body, and then a person. And before long, the village elders said, we are not going to be able to do this. We can't keep pace with this. We have got to get in our canoes and paddle upstream to see what is the source of this harm that's being done. So that's what I did. I got into my kayak and paddled upstream in the search of how do I ease this suffering. It is not acceptable for us to put, as I say, put Band-Aids on a hemorrhage. We have got to figure this out. And there's some answers to that. One of it is our explosion of population. For most of humans' existence on the planet, we have had a fairly stable population until the Industrial Revolution, and which allowed us to have shifts in agriculture and be able to have more capabilities to travel and really have sped up economies. And that's when our population took off. And it took off in such a way that we're now overshooting Earth's natural resources. The last time that we were in balance, according to Earth Overshoot Day, the last time we were in balance, humans using what the Earth is able to replenish, was 1970. And so that is a very, that was 50 years ago, over 50 years ago was the last time. And since then, we have been using more at a pace that's very frightening. Now, some people will say, well, isn't it wonderful? Silver lining of COVID is we're actually using the fewer resources and we're really helping the Earth to heal. Yes, in some respects, some of the ecosystems have restored themselves, but we've still only bought about 3 weeks of time. Ideally, in a year's time, we use a year's worth of renewable resources, and we're exceeding that still at September. We're starting to dip into savings. Now, it doesn't take anybody too long to figure out that if you have a bank account and you're constantly drawing it down, it's going to run out someday. And what's happening in addition to this whole idea of a changing planet is humans are causing forests to be cleared. We're losing biodiversity at a rate that's 1,000 times normal. There is a baseline rate of biodiversity loss, which is just in the process of evolution and beings evolving and changing. But we're having a loss 1,000 times that normal loss. We're having acidification of our oceans. Our land is becoming deserts. We have soil, air, and water pollution. Some of that is toxic waste, but also plastics. Rivers are drying up. We're having water scarcity, and it's definitely forecasted water scarcity, especially in areas like out west and in areas with large populations like the Himalayas. Extreme weather events and disasters, temperatures are on the rise, and sea levels are rising. So brief, just a point about one of these problems. There's multiple ecosystem problems happening right now. Climate change is very, very serious. It is happening now. We are seeing impacts now, and we have to get activated very, very quickly to turn this around. I want people to be aware that there's a 30-year time lag. So similar to if those of us in Minnesota, in the winter, you're chilled at night, you pull up a good blanket to over your shoulders. It doesn't automatically get hot or even warm. It takes a while to generate the heat under the blanket before you start feeling the effects. And that's what's going on with this accumulation of greenhouse gases, is there's about a 30-year lag time. So the typhoons, hurricanes, wildfires, droughts, ice storms, profound weather instability that we're experiencing today is related to the CO2 levels that were in our atmosphere 30 years ago. So even if we address today and stop our production of greenhouse gases, we're going to have 30 more years of white knuckle riding it out with escalating issues and problems. Some people will say, but this is just a natural cycle, natural pattern. So I like to show this slide 800,000 years ago, starting the monitoring of these patterns. And we know this by ice cores. Ice cores give us this information that the Earth does have patterns, and it kind of goes up, it goes down. There's warmer periods between glaciers, and then there's when the CO2 levels are low, the glacial ice, glacial age starts. And so, yes, absolutely, there are these patterns. The most that we historically have seen is about 300 parts per million of greenhouse gases historically. And right now in 2019, we're at 409. And I'm sorry to say that as of today, we're at 418. So we are not getting on top of this. We are not moving the dial on this. We are continuing to raise that level. And as the CO2 and the greenhouse gas levels go up, so does the heat. This is a map from NOAA. Every 30 years, every 10 years, they summarize 30 years worth of data and come out with reports on sort of what's happening over time. Because we know that weather is what's happening today, climate is what's happens over time. And this is a snapshot of the climate changes and the average temperature changes. And it is quite, to me, quite horrifying to see where the United States is going regarding changes in heat. And we know that this has impacts. You know, our name, the name of our state means the land of sky-tinted water. It's a Dakota word, which means that our water should be our sky should be a beautiful blue. Our water is a beautiful blue. And this was July of this past year when the wildfires in Canada, the smoke came down over our cities. This was taken during the day, probably early evening, and it was anything but sky blue. It was, as you recall, that sickening orange and yellow, which we were at a level of air quality that the World Health Organization said is very dangerous. So what else is happening in Minnesota? Our summers are cooling. However, there's an increased number of hot days with little relief at night. And when we don't have that break at night, our body is not able to accommodate to the heat. And it becomes very, very dangerous for people living in, especially places without cooling systems or in multifamily units where there's not adequate relief. In winters, our winters are actually warming. It's hard to say that on a day like today when we have polar air coming down over our state. You know, despite that, our winters are still warming. That's why we're getting ice. You know, and when I grew up, ice was something you played on and skated on. It was not something that you had to navigate regularly on your sidewalks. We're having precipitation changes, more droughts, more floods. Minnesota is kind of in a place where we have both, and we can have both occurring at the exact same time in different parts of the state. Patterns are no longer predictable. So agricultural communities, particularly that rely on the land for food and medicine, are struggling with all these changes. And we have wildfires with poor air quality days and increased length of allergies. About 21 days for the state of Minnesota is what our ragweed and pollen generating plants are growing longer. And so you might think, well, that's not a big deal. And if you say that, then I think then you don't have allergies, because allergies are not pleasant for people that are living with that and can be very health compromising for people with a respiratory condition. So in addition to all of these changes around the United States, this is all happening as well. And that there's a huge problem with the cost of this, that in 2021, these are billion-dollar weather and climate disasters. And you can see that there were just multiple disasters in this past year, and that's only forecast to get worse. And these changes affect our health. These are impacting human health right now. People with underlying cardiovascular diseases are struggling from climate-related issues such as heat and droughts, respiratory diseases like asthma, allergies, as I mentioned, any chronic obstructive pulmonary diseases are having problems with our poor air quality. Infectious zoonotic and diarrheal diseases are on the rise, including pandemics. So this is just the first of many pandemics that are sort of teeing up to be challenging humans and human society. Antimicrobial resistance is on the rise. We're continuing to have toxins, heat strokes, mental health effects, malnutrition, migration and forced displacement, civil strife, and trauma. Every year, the Landsat Countdown publishes a report on the impact of climate change on health. This was the executive report in 2019 that the life of every child born today will be profoundly affected by climate change, with populations around the world increasingly facing extremes of weather, food and water insecurity, changing patterns of infectious disease, and a less certain future. Without accelerated intervention, this new era will come to define the health of people at every stage of their lives. Now, it's one thing to remain emotionally detached from statistics, but I want you to look at the background of this particular slide and think about the children in your lives. Think about your neighbor children, your grandchildren, children in your place of faith or in your child's daycare. Think about them, that we are condemning them to have climate change related impacts on their health their entire life. And you want to know, am I doing the work that I'm asking you to do? Absolutely. The background of this picture is my son holding my 3-year-old grandson. This is real, folks. This isn't decades from now. This is real and it's happening now, and we need to take action. The Intergovernmental Panel on Climate Change report that was issued in August did not give us really much hope or encouragement that things were getting better. In fact, the science was indisputable that humans are putting human lives at risk with the changes, and that we have to act immediately. And the information was so powerful that it led the UN General Secretary to proclaim that this is code red, or that your house is on fire, for humanity. I take it a step further and draw your attention to this picture of the wildfires in Montana and the elk standing in the river trying to preserve their lives, and say that this is code red for the planet. And we know that it's only going to get worse. They're projecting that climate change will be a potent driver of migration. Right now, peoples are moving within their nations, but at some point, the entire nation is not going to be livable or survivable, and we're going to have massive migrations across the world. Half the people's world, half the population lives within 40 miles of coast. So with rising sea levels, we are going to see problems with half of our world's population needing to relocate. And it's already happening. This is a picture from up in Alaska, and the permafrost is unfreezing, and the sea levels are rising, and whole villages of indigenous people, indigenous Americans, are losing their cities, their livelihoods, and their ancient way of being and cultural connections to the land. This is down in Louisiana. And again, people living on the ocean, the bayous, where the sea level rise is causing tremendous problems in addition to the storms. And we know that it's oftentimes people with the most challenges economically and socially as well, related to racism, that suffer the first and worst of climate disasters. This report out from the Environmental Protection Agency this past September says that Black and African American individuals are 40% more likely to currently live in areas with the highest projected increases in mortality rates due to climate-driven changes in extreme temperature. Black and African American individuals are 34% more likely to live in areas with the highest projected increases in childhood asthma and related to air pollution. And Hispanic and Latino individuals are 43% more likely to live in areas with the highest level of labor losses due to weather-exposed industries. Roofing, landscaping, construction, outdoor jobs that require people to take shelter when the air is poor quality or the temperatures are too high. So many of you know this, Greta Thunberg, the iconic climate activist. She said, "We can't save the world by playing by the rules, because the rules have to be changed. Everything needs to change, and it has to start today." And that is exactly the point. We do not have decades to play with this. We do not have unlimited time to solve this. Everything needs to be changing within the next 10 years. Now, we can hear that and enter total despair, or we can say, you know what? Humans are pretty remarkable. And with good leadership and working together in partnership, we can make this happen. And as just a simple example, I like to show this picture of New York City on Easter Day in 1900, and just looking at, where is the automobile? Everything's horses and buggies in 1900. By 1913, same street, same date, and you're hard pressed to find a horse and buggy. That was roughly a 10-year shift from one form of transportation to another form of transportation. And we can do that, folks. We know what to do. It's a matter of will. So I just want to breathe. I've talked about the tough stuff. I've talked about the urgency and how we need to activate. And again, I want to give us just space to grieve what it means if we don't take action, to worry about our families, to feel sad that we've taken so long and been inactive so long. Whatever emotion you're feeling is an emotion worthy to feel. And I just urge you to just let that be and give yourself permission to be in that space. But I only have an hour to speak. So now I want to turn to why am I hopeful in the midst of this? And I'm hopeful because of this development of planetary health. Many of you have heard of public health, eco health, One Health, global health. All of those are paradigms of some combination of human health work, human health industry and health work, animal health work, and our environment in relationship to our environment. Planetary health takes it the next step and incorporates all those and invites all disciplines to the field. So planetary health is an ancient field. Indigenous people lived, breathed, valued a planetary health mindset. It's those of us that have lost our memory of indigenous knowledge that need to move, be re-educated. And so the planetary health movement started in about 2015 with a publication from the Lancet and Rockefeller Foundation. Since then, last spring, we issued a planetary health education framework that anybody can use. We gathered experts from around the world, from various fields, and said, okay, what do all students in all fields that graduate from college need to know in order to be able to practice in a planetary health way or a planetary health approach? We started out probably with 1,000 suggestions of items to go into the shared curriculum. Well, obviously that wasn't going to work. So we winnowed it, shook the grain up in the air, and they came down to the seeds or the kernels of these 5 things. We believe all people need to understand the Anthropocene, that humans are impacting health. We believe that any approach needs to be equitable, and we need to consider social justice. People need to understand how systems work and complexity, and how to build movements and how to change systems. And at the very core of all of that, connecting all of that, is interconnection within nature. We need to shift from here's humans over on the left hand, here's nature on the right hand, and humans need to learn how to play with nature, work with nature. No, we need to shift our paradigm where we realize we are nature, and anything we do impacts the whole. Now, instead of this being linear, of you do one, then the next, the whole thing is wound together like a rope. Because all those 5 pieces are wound together like a rope, so this is like a cross section of a rope, it is much stronger because we have them all working together. I also want to draw you to, I do a lot of work at the Planetary Health Alliance at Harvard, which is the global secretariat for the planetary health movement and planetary health work, planetary health research, planetary health science, publications, education, etc. And they're at their annual meeting last spring, over 5,000 people attended virtually. It was going to be in Sao Paulo, but unfortunately, due to COVID, we went virtual, which was a wonderful thing because we attracted more people that couldn't travel, and we kept our carbon footprint down. So at that Sao Paulo conference, the global community weighed in on how do we start to make these changes and these transitions so that we have a future that everybody can survive. And it's called a great transition. We're at a fundamental shift, right? Or we're calling for fundamental shift across the planet. In all things, we have to do deep structural changes in most dimensions of human activity. That means our policies, our education, our healthcare, the way we tell stories and spiritual movements, our science, our economics, everything has to change. And so, oops, I'm getting trigger happy here. So I urge you to take a look at this document because it is a guiding document. In this document, the global community has messages for each of these sectors. And so I urge you to, and all of us, to think about where can we tip the system. Here I am figuring out where I can tip the system. And a couple things that I've done in the health sector are looking at our curriculum and how we bring forth planetary health experts for the future. Also looking at sustainability and decarbonization. So here's the recommendations for the health sector of what we need to do. Now, unless you're in the healthcare sector, I don't feel that you don't have to feel like you've got to get to work in this area. But there are going to be some transdisciplinary cross-sector experiences that all of you can get involved in with health professionals. So we as health professionals are called to be involved in ensuring that there's communities have access to public and active transportation, especially of a renewable source, that we have green spaces for everyone, that we protect our air, soil, and water. So you can hear the sort of cross-sectionality of these. Another movement that I'm involved in is I helped launch Nurses Drawdown. Project Drawdown is a wonderful organization that is really the go-to place for the science of drawing down our greenhouse gases, which initiatives are most effective, which work is most effective. And in 2014, I marched in the People's Climate March in New York City with 500,000 people. And I carried a simple sign that said, nurses for a healthy future. I didn't have whites on. I didn't have a stethoscope around my neck. I just carried the sign that said nurses for a healthy future. And what happened next just shocked me. And that was people came off the curb and off the street and said, the nurses are here. The nurses are here. And they took selfies with me and they wanted to send pictures to their parents and their family. And I thought, what the heck is this? They're not doing that with my other colleagues that are engineers or teachers or in other fields. And I recalled that for 20 years in a row, the field of nursing, according to the Gallup poll, is the most trusted profession of all professions. Hands down, we're 20 points higher than most of the others. People trust us the most. So I began to think, can we leverage people's trust, the public's trust of nurses, leverage that to scale drawdown solutions? I pitched it to Project Drawdown in California and said, have I got a deal for you? I'm willing to mobilize the global nursing community if you're willing to work with us to help us understand these solutions and how to push them out. And so Nurses Drawdown was born, and I'm happy to say that it is a global movement, and we're teaching our nurses to be honoring these initiatives. What they are, and it really draws into your work, is we are encouraging all our patients, communities, families, nurses, their families to eat a plant-based diet. In the global south, where there's a lack of access to clean cook stoves. We're urging clean cook stoves. We want to decrease food waste. We also chose educating girls. Educating girls is one of the most potent ways to decrease our greenhouse gas emissions. We are encouraging walkable, bikeable cities, renewable energy sources, and planting trees and protecting our forests. All of these we chose out of the hundreds and hundreds of drawdown solutions. We chose these 5 because they have a co-benefit of, as we do them, they improve human health and the health of the planet. So we're on the move, folks. Nurses are on the move. I talked about climate change curriculum, and we have this embedded in all the health sciences at the University of Minnesota. But here's one for you. This is what the global community says for those of you that work in cities, that we need to recognize that most of humanity lives in cities, and it's going to continue to be this way, and that this is where our action needs to focus. The design of cities needs to be environmentally friendly with materials that are reused and recycled. We need to be designing and incentivizing green energy. We need to be looking at neighborhoods with making sure that everybody has adequate outdoor space and active places for active transportation, which means bikeable, walkable areas. We need to look at public transportation, make sure that we're decreasing automobile use and that everything's grounded in equity. Create waste management systems that protect our ecosystems, recapture energy and water, design cities to meet their potential to reduce our ecological footprints while optimizing physical and mental health. That's our marching orders for those of us that are involved in cities. So we are programmed as a species to pay attention to the lion. Most of human existence, or most of human evolution, occurred when humans lived on the African savanna. So we're very aware where the predator is. The predator is over the mountain range. We just don't kind of worry about it. Once it starts to get into our territory, or on the periphery of our territory, leaders and healers and people charged with protecting the village and the people pay attention to where the lion is and that it's starting to come near. Those days are long past. The lion is in the village right now. We don't have the luxury of watching and waiting. It is here. And we need to act, and we need to act quickly, and we need to be working together to be working on the most effective solutions. I like this proverb, and I'll close with it, that sometimes in the face of all this, you can feel like, what is one person going to do? What can I possibly do? The web of life is so huge, and I'm just one person. But this is an Ethiopian proverb that when spider webs unite, they can tie up a lion. And that is absolutely correct. When we unite, when we work together, we can tie up this lion. We know how to do it. It's a matter of coming together and working together. So I will end with this. We'll enter a time of questions and answers. I've made the PDF of this presentation available to go out after this talk. And it has some of the links that I talked about, the link to the Sao Paulo Declaration, the education framework, and some other things that I feel are valuable. So at this point, I'll turn to my wonderful hosts and see if any questions came in.
Thank you so much, Teddie. That was great. I love the arc of the presentation from the problem to the action. I think that's really valuable. I haven't gotten any questions yet, but I wanted to ask a question to the audience, and maybe they can think during. I was curious, how has climate change consequences, how have they appeared in your daily work for Hennepin County? I think we have been talking about systems and systems of systems. So it really is kind of every level that this is taking effect. So if people have ideas for that, please feel free to share them in the chat. Also, when I was listening, I was reminded of a quote from Braiding Sweetgrass, which I'm sure a lot of people have heard or maybe have read, which is, knowing that you love the earth changes you, activates you to defend and protect and celebrate. But when you feel that the earth loves you in return, that feeling transforms the relationship from a one-way street into a sacred bond. And yeah, if you've read that book, I don't know, that one stood out to me after I read it.
Absolutely. So while people are thinking, I do want to circle back around and talk about the mental health impacts of climate change. Certainly, we know that people who are already living with a mental health challenge or disease, any imbalance, economic, pandemic is a huge complicating factor of people with living with a mental health condition. But climate change impacts the health, the well-being of all of us. And I want to draw particular attention to our youth who are in despair. I have college-age students who say to me, you know, what's the point of continuing on in college? Why should I even think about a career? I'm not planning on developing relationships, serious relationships, or having children. I gave an international talk for medical students, and the first question out of the gate was, is it unethical to have children? Imagine living with that burden that your future is in question, and your future of children or potential children is in question. So all of us that work for government, schools, need to be healthcare, need to be aware of this is the generation right now who's grown up with climate change as the reality and how it's impacting them.
We did get a question, which is to say more about Nurses Drawdown, and specifically, are there entire clinics and hospitals signing on to this? Is it just individuals, or yeah, what kind of level of signing on are we seeing?
Great. So we're not seeing necessarily hospital systems sign on yet. We're seeing nursing systems. So our Honor Society, National Society of Student Nurses, National Hispanic Nurses Association. So groups and organizations signing on as in addition to individual nurses around the world. But we hope that as nurses start to get involved in these initiatives, other places will too. The big issue in our health systems right now is decarbonization. And the National Academy of Medicine, as well as the other national healthcare academies, are working on this right now. We're going to be publishing a huge report in the next 2 to 3 years about how do we decarbonize the US healthcare system. Now, here's something that I find really hopeful. As a nurse, I think this is kind of interesting. About 80% of our carbon footprint in healthcare is related to our production of pharmaceuticals and biotechnology and shipping things back and forth, supplies back, you know, across the world, et cetera. 80% of our carbon footprint. So if we can have a healthier population who require fewer pharmaceuticals, who are more active and keep their joints in good shape and keep their hearts in good shape, and understand how to live safe lives so they have fewer injuries, we can have an impact on not only the health of people and alleviating suffering, but also on this darn CO2 and what it's doing with climate change. So I find that pretty interesting, that it's in our best effort, in our best interest, to ensure that all people living in our counties are healthy.
I had a question, which was, for Project Drawdown, you were able to move it forward to have this focus on nurses. Are there other efforts with specific systems or specific focus areas, and which sorts of those exist at this point, or which ones are in the making?
Yeah, there are. So I would urge you to go to the Project Drawdown site, and they are evolving. There's a teacher's drawdown now to really get education moving in this direction. There's a program that's working with the Global South and making sure that it's not just nations that are advantaged that are working on this, but how do we support nations that are economically more challenged to be involved in also making greenhouse or drawdowns decisions. So they are definitely moving ahead in this work. We were one of the prototypes for how do you have a specialty or specialty taken on, and I'm happy to say it's growing, and there's nothing that says there couldn't be a city urban planning county, a national county initiative. I didn't include in this slide deck the economic impact of climate change disasters per county. There's a whole map of per county who's suffering the worst. Certainly it's southern United States right now that has the hugest or the largest impact on the GDP of counties. But you might get some county commissioners that would be very interested in that.
I think so. You touched a little bit about capacity for action, and one of the questions we just got goes more in depth into that, which is, how does Nurses Drawdown work with the public health system in supporting community-based initiatives that can help patients and residents contribute within their capacity? And I think it's always an important consideration when we are talking these big systems changes. What can the individual actually contribute with our different levels of capacity?
Absolutely. And so Nurses Drawdown was officially launched last summer, midst of a pandemic, or summer of 2021. So it's on our list to continue to build movements, continue to have nurses working on this, and public health nurses, and really work with public health departments. So I would say it's not premature to reach out to Nurses Drawdown or Project Drawdown and pitch it something. If you want to have a relationship with nurses, absolutely pitch it to us. So you can go to Nurses Drawdown. It's run through the Alliance of Nurses for Healthy Environments, and just pitch your idea. I think that's the take-home message of Planetary Health right now. This is not a laundry list or a grocery list that is all set in stone of how we are going to take action. It's calling every single one of us to say, what talents do I have? What skills do I have? And how do I bring them to the table in order to amplify this movement, in order to bring this moving forward? So you know things that I certainly don't know. And getting the community involved is huge. I've been doing work with Liberty Community Church and Northside Healing Space this year, and their pastors said, look, we're suffering worse and worse, first and worse. Our community in North Minneapolis is going to be hit the hardest with heat, drought, asthma related issues along the 94 corridor. What do we do? And we don't know anything, much about climate change. We've been sort of left out of the circle of environmental work. So we worked together, and we hosted a 3-day event on Planetary Health that was sponsored by Liberty Community Church, and we informed their community about what's happening and how they can get involved. It's a beautiful celebration. It closed with down on Halls Island a celebration of music, and I arranged for the Minnesota Raptor Center there, so the Eagles and Hawks and Owls showed up. Little kids' eyes were just huge, seeing this connection of the river, the animals, their work, their spiritual community, and seeing that they had a role to play. They're needed in this movement. So absolutely, community outreach is huge.
Well, thank you so much. If anyone wants to have any last questions, we invite them. Otherwise, thank you again. This has been a great talk. I'm also excited. I wanted to mention that we're doing a symposium on climate action, specifically as it relates to transportation. So one of the many systems that you mentioned. So that's coming up sometime. We're hoping for March. And in some ways, I think that'll be a continuation of this discussion. So we hope a lot of you that are here today can join. And I'll also say, we'll be sending out the resources that Teddie showed, as well as a recording to the event. And yeah, I failed to introduce Scott at the beginning. Of course, Scott is the director of the Hennepin-University Partnership. Scott, if you wanted to say hey.
Well, thank you for the introduction, Kenny, and thanks everyone for joining this very important conversation. And Kenny, why don't we send the form to everyone about the symposium later in March, so you can indicate interest if you'd like to attend that. Thank you again.
I urge you to join the Planetary Health Alliance. You can join as an individual, and then you'll be get their newsletter and be notified of the national conference, which is occurring next October. And so you'll be in on this global community of people working together on behalf of this whole initiative.
Excellent. Well, thank you, everyone, and you'll get an email from HUP soon enough, and we look forward to continuing the discussion soon. Thank you.